Well, obviously, it doesn't work for everybody, and I think that's why you're here, each of you. And the question then becomes, what's the heart of the problem? Is the heart of the problem bad training? Is the heart of the problem bad information? Is it, lack of coordination? Like, what is the heart of the problem? And for me, after almost 20 years in healthcare, I came around to the fervent belief that the heart of the problem is a lack of financial alignment between what's good for the individual actors in the system and what we as a society want.
So when you meet with CEOs of hospitals across this country, do they say, you know what I want? An algorithm? No. What they say is, my margins are thin to negative. It is hard to retain and hard to recruit specialty staff, and everyone's burned out. So when an entrepreneur, for example, goes to these CEOs and says, oh, I've got this technology, I've got this cloud, I've got this generative AI, they don't care. They want to simply know, does this product or service you are offering help my margin improve? Help me, make my existing specialty staff more efficient or reduce burnout? Well, let me answer that one in an interesting way, which is I've written a lot of regulation. And regulation has a lot of unintended consequences. And it's something to keep in mind, and legislation too. But let's think back in the meaningful use era, where we said we want to digitize the electronic health records of this country. Well, how was that done? As you say, I was on the committee, so I went to the CDC, and the CDC said, syndromic surveillance, let's look for outbreaks. That's important. Oh, who could argue with that? I went to CMS, and CMS said quality measures are important. Why don't we have 40 of them, numerators and denominators for every physician at every encounter to ensure they record for quality? Well, who could argue with quality? FDA wanted drug and device post-market surveillance. Well, that sounds reasonable. By the time we were done writing the regulation, every physician at every encounter, who had, that physician has 11 minutes to see the patient, make eye contact, be empathetic, and never commit a malpractice, had to enter 140 data elements. It's impossible. So just recognize that there are unintended consequences of all regulatory and legislative activities, and to be very careful with the amount of burden that is created for the benefit gain.
The temptation often is, and the drive from the policy point of view is to do too many smaller things rather than focusing on a very small number of very big things. And in my view, in terms of the push to value-based care, they've done a lot of things right. But we are at the stage of adoption of value-based care in this country where we are now reaching into the mainstream primary care doc, not the early adopters, not the innovators, but the mainstream. And what the mainstream wants to hear is not, here's another new model. What they want to hear is, and this is what we did with meaningful use in electronic health records, this is the way. That's what they want to hear. You have to do this, right? You're going to have to do this anyway. May as well do it now, and this is the way to do it. At the end of the day, the shortage of primary care is not, honestly, about we don't have enough residents going into primary care residency training programs. That's a symptom. The heart of the issue is that if you're a urologist, you make 2.5 times what a primary care doc makes. And so the urologist gets to have a big office with 15, people helping that single physician have the greatest throughput. If we paid primary care more, if they were able to capture some of the savings they can create, if we go from 5% of healthcare spending being primary care to 10%, then that will expand primary care capacity. They will be able to have more of those nurse practitioners and physician assistants and medical assistants working for primary care clinics versus urology clinics. And yeah, we'll have more trainees going into primary care if we equalize some of those payments based on the value that they're creating.
Well, here's an interesting question for you. Let's take somebody you think of as iconic in our industry. Steve Jobs, Elon Musk, right? Pick your person. What's their success rate really? If you were to look at, 20, 30 years of their career, the answer is, hey, maybe they hit 80% failure, right? Stuff doesn't work. And so when I went to the board of directors of Mayo and said, we're going to embark upon all these new platform models and digital pathology, cancer care beyond walls, that sort of thing, would you allow me an 80% failure rate? And they said, yes, because actually 80% failure is better than most startups, which are at 90%. So I think make sure you have air cover. Whoever is your supervisor, whether that is a direct boss, whether it's a board of directors, whether it's an institution, that people just need to understand there is no such thing as innovation without risk.